James was 75 when his daughter noticed something unusual. Every evening, he slipped off his shoes the moment he walked through the front door, not because they were uncomfortable, because they no longer fit. His ankles had become so swollen that the socks left deep marks in his skin. James immediately feared the worst. He convinced himself his heart was failing. He stopped taking his evening walks. He drank less water because he thought he was retaining too much fluid. Week after week, he became less active, less confident, and more worried. But the real cause was something he never expected. It was one of the medications he had been taking every single morning. Not because the medication was dangerous, but because nobody had explained how it actually worked. I am Dr. Arthur Vance, and if you take amlodipine, Losartan, Lisinopril, or another medication for high blood pressure, today's conversation could help you avoid mistakes that many older adults make without realizing it. These medications have helped millions of people lower their risk of stroke, heart attack, and kidney disease. They save lives every day, but like every medication, they also have side effects, interactions, and warning signs that deserve attention. As a son, I would never want my parents taking a powerful medication without understanding what changes are normal, what deserves a phone call to the doctor, and what requires immediate medical attention. Because knowing the difference can prevent unnecessary fear and, in some situations, prevent serious complications. Before we begin, tell me your age and where you're watching from. I always enjoy seeing how many people from around the world are part of this community. Now let's start with something many people never realize. Not all blood pressure medications work the same way. People often think they are simply different brands doing the same job. That is not true. Each medication lowers blood pressure using a different pathway inside the body, and because they work differently, they also produce different side effects. Understanding those differences makes you a much safer patient. Let's begin with amlodipine. This medication belongs to a group called calcium channel blockers. Its job is to relax the muscles inside your arteries. When those muscles relax, blood flows more easily, and blood pressure falls. For many people, it works extremely well. But there is one side effect that surprises thousands of older adults every year: swollen ankles. By late afternoon, shoes may feel tighter, socks may leave deep impressions, your feet may look puffier than they did in the morning. Many people immediately think their heart is failing. Others assume their kidneys have suddenly stopped working. In many cases, neither is true. What is happening is much simpler. Amlodipine allows more blood to enter the tiny blood vessels in your legs, but the veins carrying blood back toward the heart do not relax in exactly the same way. That creates extra pressure inside the smallest blood vessels. Some fluid then leaks into the surrounding tissues. The result is swelling. Now here is where people make a mistake. Some stop taking the medication without telling their doctor. Others stop drinking enough water because they believe they are retaining fluid. Neither is the right answer. If swelling appears after starting amlodipine, your doctor should know. Sometimes adjusting the dose helps. Sometimes changing medications helps. Sometimes simple measures, such as elevating the legs or wearing compression stockings, make a noticeable difference. The important thing is having the conversation, not suffering in silence. Now let's move to lisinopril. This medication belongs to a different family called ACE inhibitors. One of its most well-known side effects is a dry cough. Not the kind of cough that produces mucus, not the cough you get from a cold. This one feels like a constant tickle deep in the throat. Many people clear their throat dozens of times a day. Others wake up coughing throughout the night. What makes this especially confusing is that the cough often does not begin immediately. Some people develop it weeks after starting the medication. Others do not notice it for several months. By then, they blame allergies, dust, acid reflux, even the weather. Very few suspect their blood pressure medication. I remember one patient who spent months buying cough drops, allergy medicine, and humidifiers before realizing the medication was the real cause. Once her doctor changed her prescription, the cough gradually disappeared. But there is another side effect with lisinopril that is far more serious. Fortunately, it is rare, but every person taking this medication should know about it. If your lips, tongue, throat, or face suddenly begin swelling, especially if breathing or swallowing becomes difficult, treat it as a medical emergency. Do not wait until morning. Do not try to manage it yourself. Seek emergency medical care immediately. Thankfully, this reaction is uncommon, but knowing about it could save a life. Now, let's talk about Losartan. Losartan works differently from Lisinopril. Many people who develop a cough on Lisinopril are switched to Losartan because it usually does not cause that same problem. However, Losartan has something else you should understand. It can increase potassium levels in the blood. Now potassium is essential. Your muscles need it. Your nerves need it. Your heart depends on it. But too much potassium can create problems. And many people accidentally increase their potassium without realizing it. One of the biggest surprises comes from salt substitutes. Many products marketed as healthier alternatives to table salt replace sodium with potassium. Someone trying to protect their heart may unknowingly add large amounts of potassium to every meal while taking Losartan. Most people never think to mention this during a doctor's visit, yet that combination may increase potassium levels more than expected. High potassium sometimes causes muscle weakness, fatigue, unusual cramping, or an irregular heartbeat. Sometimes there are very few symptoms at all. That is one reason your doctor occasionally orders blood tests while you take these medications. Those tests are not routine paperwork. They help confirm your kidneys and electrolytes remain healthy. Now, this next situation deserves special attention. Imagine you develop a stomach virus, you have diarrhea, you are vomiting, you cannot keep fluids down, or perhaps it is an extremely hot week and you become dehydrated. Your medication has not changed, but your body has. When you become dehydrated, blood pressure medications may lower your pressure more than expected. Some people become dizzy, some become extremely weak, others place additional stress on their kidneys. That is why every person taking blood pressure medication should ask their doctor one simple question. What should I do if I become seriously dehydrated or cannot keep food and fluids down? Many people never ask. But having a plan before illness happens can make a tremendous difference. Now let me mention another common mistake. Many older adults take ibuprofen or naproxen for arthritis pain. They are available without a prescription, so they seem harmless. But these medications can reduce blood flow to the kidneys. When combined with medications like Lisinopril or Losartan, especially during dehydration, the kidneys may be placed under extra strain. That does not mean nobody should ever take these medications. It means your doctor should know if you are using them regularly. Sometimes there are safer options. Sometimes a simple adjustment is enough. Again, communication matters. Now let's talk about something almost every older adult has experienced. Standing up too quickly. The room briefly spins. You grab the chair, then everything settles down. Many people dismiss these episodes. I just stood up too fast. Sometimes that is exactly what happened. But if dizziness becomes frequent after starting blood pressure medication, do not ignore it. Even a few seconds of dizziness can lead to a fall, and after 70, falls often cause injuries that change lives. Broken hips, broken wrists, head injuries, loss of confidence. The solution is often simple. Stand slowly, pause before walking, hold on to something stable if needed. But recurring dizziness deserves a conversation with your healthcare provider. Your medication may need adjustment, your hydration may need improvement, or another issue may be contributing. Now I want to address something that creates unnecessary worry. Home blood pressure readings. Many people become anxious over one high number or one low number. But blood pressure naturally changes throughout the day. It rises, it falls, stress affects it, poor sleep affects it. Pain affects it. Even talking during the measurement affects it. One reading rarely tells the full story. Doctors look for patterns. That is why measuring your blood pressure the same way each time is so important. Sit quietly for several minutes first. Use the same arm. Measure at approximately the same time each day. Keep a written record. Then bring those numbers to your appointments. Patterns help doctors make better decisions. Single numbers often create unnecessary panic. Finally, remember one important fact. These medications work best when taken consistently. Do not double a dose because one reading seems high. Do not skip tomorrow's pill because today's number looked good. Blood pressure medications are designed to work steadily over time. Consistency protects your heart. Consistency protects your brain. Consistency protects your kidneys. As we finish today, I want you to remember something. Blood pressure medications are not something to fear. They are tools, very effective tools, but every tool works best when you understand how to use it safely. Know your medication, know the common side effects, know the warning signs that deserve immediate attention, and never hesitate to ask questions during your appointments, because the more you understand your treatment, the more confidently you can take charge of your own health. I am Dr. Arthur Vance, and your health is the only metric that matters. I will see you in the next consultation.